Health 54 right here on your digital first Pan-African news network, TOS Television. I am W.H.0. According to the World Health Organization, an estimated 20 million people were diagnosed with cancer and 10 million died of the deadly but preventable disease in 2021. The global health body also noted that the numbers will continue to rise in the decades ahead. In its World Cancer Day statement with the theme, Closing the Care Gap, WHO said, care for cancer, however, like so many other diseases, reflects the inequalities and inequities of our world, as the clearest distinction is between high and low-income countries, with comprehensive treatment reportedly available in more than 90% of high-income countries, but less than 15% of low-income countries. It also said the survival of children diagnosed with cancer is more than 80% in high-income countries and less than 30% in low and middle-income countries, adding that breast cancer survival is 5 years after diagnosis and now sits 80% in most high-income countries, compared with 66% in India and just 40% in South Africa. A consultant radiation and clinical oncologist, Bolaji Salako, says regular screening and prompt diagnosis can help in the early detection of cancer to save more lives. Salako of the Federal Medical Center Idiaba, Abeokuta, disclosed this in an interview with newsmen in Ibadan. He spoke against the backdrop of the World Cancer Day tagged Close the Care Gap, slated for February 4. On February 4 every year, the global cancer community commemorates World Cancer Day to inspire greater awareness of cancer and action to better prevent, detect, and treat the disease. World Cancer Day 2022 marks the first year of a new 3-year campaign centered on the issue of equity. The 2022 campaign raises awareness about the lack of equity in cancer care. 3 suspected fake healthcare workers on an unauthorized medical mission in Asarama, a community in Andoni local government area in Rivers State, have been apprehended by the police. The medical director of the council, Dagogo Theophilus, disclosed this in an interview with the newsmen on Thursday in Port Harcourt. Dagogo said that the unauthorized team had carried out appendicitis and hyena surgical operations on 7 patients before they were apprehended. And the Nigerian government launched a 62.1 billion HIV trust fund as part of efforts to reduce funding gap and also place more people living with HIV on treatment. Speaking during the launch held at the banquet hall of the State House, Abuja, on Tuesday, the Director General of the National Agency for the Control of AIDS, Gambo Aliu, said the fund will help the country fight the HIV epidemic. Aliu said the fund is a sustainable financing mechanism for the mobilization and deployment of domestic private sector resources to address the prevention of mother-to-child transmission of HIV in Nigeria. This is TOS Television, your digital first Pan-African news network, and you're watching Health 54. More stories plus Nigeria's COVID-19 update when we return. Stay with us. Welcome back. President Muhammadu Buhari on Thursday in Abuja launched the revised National Policy on Population for Sustainable Development, stressing the need for urgent measures to address Nigeria's high fertility rate through expanding access to modern contraceptive methods across the country. The president also inaugurated the National Council on Population Management, chaired by him, and the vice president as the deputy chairman, with heads of relevant ministries, departments, and agencies as members. Speaking on the country's reversed population policy, the president said its overall goal is to improve the quality of life and standards of living of all Nigerians, which is one of the major aspirations of his government. A consultant obstetrician and gynecologist, Adebayo Adeniyi, has called on the federal government to allow those suffering from infertility enjoy necessary benefits from the National Health Insurance Scheme. Adeniyi, who is the medical director Holy Specialist Clinic at W.H.0 said infertility is an important disease that affects the state of health of an individual, going by the World Health Organization's definition of health. The expert spoke in at W.H.0 while reacting to a 63-year-old retired public servant who was delivered of a baby boy after conceiving through IVF in the clinic, saying the clinic has recorded impressive results from IVF treatment since the delivery of the first set of babies in October of 2019. And the Commissioner of Health in Kaduna State, Amina Muhammad Baluni, has said that cholera outbreaks has killed 175 people across the 23 local government areas of Kaduna State in 2021. Baluni spoke when receiving cholera testing equipment donated by the World Health Organization to the state in Kaduna, which were meant for the zonal cholera laboratory located at the late Yusuf Dansofo Memorial Hospital in Tudunwada. Baloni told journalists that Kaduna witnessed 175 deaths due to cholera outbreak in 2021, as almost all the 23 local government areas in the state were hit by the disease. She said the donation by the World Health Body will go a long way to enhance the containment of the disease in the state. And just before we go, the Nigerian Center for Disease Control, in an update published on its Facebook, confirmed 100 new cases of the coronavirus across 14 states and the Federal Capital Territory. This is higher than 65 infections reported on Wednesday. The 100 new infections, according to the agency, raised the total number of confirmed cases to 253,505, while 229,893 people have recovered and have been discharged. With no additional COVID-19 related deaths recorded for the day, the death toll from the virus stands at 3,136. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS TV Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS TV Network. Remember, health is wealth. So till I come your way again, to stay healthy. I am Rose Audu, and many thanks for watching.